Welcome back, my students. Dr. Droogway here, and today I bring you chapter 33 from Guidance Physiology, that is the normal electrocardiogram or ECG. The understanding of ECG is very important in our medical journey. So let's begin with our topic. No need to write anything. My handwritten notes are in the description of this video in my Telegram channel. Go check them out. So let's begin first with what is ECG. When a cardiac impulse passes through heart, this cardiac impulse generates an electric current in the heart, and some of those current goes to the adjacent tissues of the heart, and some of those current go to the surface of the body. If we place electrodes on skin on opposite sides of heart, these electrodes will measure electric potentials. These electric potentials are generated because of the current on the surface of the body. So when we measure these electric potentials and record them graphically, that graphical representation is called ECG. So what is ECG? When a cardiac impulse passes through the heart, this cardiac impulse generates an electric current in the heart. Some of that current goes to adjacent tissues and some of those currents go to the surface of the body. When we place electrodes on skin on opposite sides of the heart, those electrodes measure electric potentials. These electric potentials are because of the current on the surface of the body. When we record these electric potentials graphically, that graphical representation is called the ECG. So ECG is the graphical representation of the electrical activity of the heart. Very simple. Now, what I taught you so far, these are the notes of what I taught you so far. When a cardiac impulse passes through the heart, electric current also spreads from the heart into the adjacent tissues surrounding the heart. A small portion of the current spreads all the way to the surface of the body. If electrodes are placed on skin on opposite sides of the heart, electric potentials generated by the current can be recorded. The recording is known as ECG. Very simple. Now moving forward. Now we know what is ECG. This ECG machine, it works on the principle of galvanometer. What is galvanometer? It is a device that measures magnitude and direction of current. So any device that measures magnitude and direction of electric current, that device is called galvanometer. And on this principle of galvanometer, ECG machine works. Let us suppose this right here is a galvanometer. Clear? It is a needle of galvanometer. This needle can move either towards right, that's called a negative deflection, or it can move towards left, that's called a positive deflection. So either the needle move towards right or left. By doing so, it shows the direction of the current. This galvanometer also shows the magnitude of electric current. Magnitude means size or amount. If large amount of current passes through the galvanometer, the deflection will be large. If small amount of current passes through the galvanometer, the deflection will be small. Clear? So the galvanometer shows the magnitude and direction of electric current. Now moving forwards. Let's suppose this right here is a human heart. Clear? A human heart has 4 chambers, 1, 2, 3 and 4. This is the left atrium, this is the left ventricle, this is the right atrium and this is the right ventricle. Clear? So this right here is a human heart. Now let us take a small piece of human heart. So this right here is a piece of myocardium or a piece of human heart. Now we join this human heart to a galvanometer. One end to the negative terminal of galvanometer and another end to the positive terminal of the galvanometer. Let's name this point A, let's name this point B. And these are the cells of this part of human heart. Clear? Because every living tissue is made up of cells. So these are the cells of this part of human heart. Now, let's take out this cell. This is the cell of human heart. When a heart is resting, that means heart is not doing any work. That means heart muscles are not doing any work. That means the cells are not doing any work. When the cell of human heart is resting, that means inside of the human heart there is presence of lot of negative ions. When a cell is resting, the inside is negatively charged because of the presence of lot of negative ions. So these cells, this part of human heart is resting. So all these cells are negatively charged inside because of the presence of lot of negative ions inside. Clear? So this myocardium part, it is resting. Now, as you can see, in this resting myocardium, there is no movement of ions from A to B or from B to A. So the galvanometer, the needle of the galvanometer will show no deflection. That means it will stay at 0. Clear? So this is the case number first. When the heart is resting, there is no deflection in the galvanometer. Clear? Now we move on to the case number second. Let us suppose this is the same myocardium. One end is joined to negative terminal and another end is joined to positive terminal, and this is the head of galvanometer which will show deflection. And these are the cells of this part of human heart. Clear? All these cells are negatively charged because this part of human heart is resting. Let us suppose we give a stimulus at point A. This is point A, this is point B. We give a stimulus at point A. Now, this is a resting human cell, human heart cell. The inside is negatively charged. When we give stimulus to this cell, what happens is that when we give stimulus, there is an entry of lot of sodium charge inside the cell from extracellular fluid. Because of the entry of this sodium, the inside becomes positive charge. Clear? And this entry of sodium because of the stimulus is called depolarization. So when we use stimulus to a resting cell, inside becomes positive because of the entry of sodium ions from extracellular fluid, and this entry of sodium makes the inside of the cell positive, and this entry of sodium is called depolarization. Clear? So when we use stimulus at point A, this cell became positive because of the entry of sodium from extracellular fluid. This is extracellular fluid, so sodium entered. Similarly, this cell became positive, this cell became positive. Now, another concept. This is one human heart cell. This is its adjacent human heart cell. The two human heart cells are connected by gap junctions. This is a gap junction. When this cell became positive, these positive ions leak through these gap junctions and make this cell positive. Clear? So when this cell became positive, through gap junctions, the positive entered into this cell. Similarly, this cell became positive. These cells became positive because of gap junctions. So what is happening here? A wave of positive charge is moving from A towards B. So a wave of positive charge. This entry of positive charge is called depolarization. So we can call this wave of depolarization. Clear? This wave of depolarization is an electromotive force, and every force, including electromotive force, can be represented with the help of a vector. And we have studied in previous classes, a vector has two things. A vector has magnitude, a vector has direction. Clear? And magnitude can be represented by the tail of the vector, and direction can be represented by the head of the vector. So this is a vector, this is the tail of the vector representing magnitude, and this is the head of the vector representing direction. So this is a vector. Similarly, so this wave of depolarization can be represented with the help of a vector. So that vector is this. So this is the vector. And in the head of the vector we will write positive charge, because this wave of depolarization is a wave of positive charge moving from A to B. So this is a vector. What is this vector? This is a depolarization vector. Clear? Now, this positive is moving towards a positive charge. This wave of depolarization is a movement of positive charge. This positive is moving towards a positive charge. Whenever a positive is moving towards a positive, this galvanometer will show positive deflection. That means needle will move towards this side. Clear? Because on the right there was negative deflection, on the left there was positive deflection. Because positive is moving towards the positive charge, the galvanometer will show positive deflection. So this was the case number second. Now moving on to the case number third. Case number third. Let's suppose this is the same part of human heart, myocardium part. Now these are the cells of this human heart part. So these are the cells of this human heart. This is the negative terminal, this is the positive terminal, and this is the galvanometer. This is 0. Clear? Now all the cells have become positive charge because of this wave of depolarization. Now all the cells are positive charge. Clear? When all the cells are positive charge, so this is the case of complete depolarization. Case of complete depolarization. When all the cells have become completely depolarized, after complete depolarization, all the cells have become positive. There is no movement from A to B. There is no movement of charge from A to B or from B to A. That means galvanometer will show no deflection. So this was the case number third. So what are the case number first? When the cell is resting, there is no deflection in the galvanometer. When there is wave of depolarization, positive is moving towards the positive charge, there is positive deflection. And when there is a case of complete depolarization, when all the cells have become completely depolarized, there is no movement of charge from A to B or B to A. That means there will be no deflection in the galvanometer. Now we will move on to the case number fourth. Now case number fourth. Let us suppose this is the same resting myocardium. That means all the cells of this myocardium are in a negative state. Clear? Let's suppose this is point A connected to the negative terminal of the galvanometer. This is point B connected to the positive terminal of the galvanometer. This is the galvanometer. This is the needle at point 0, and these are the readings: negative 10, reading of negative 20, reading of plus 10 and plus 20. Clear? So this is the galvanometer. Now let us suppose we stimulate this myocardium at point B. When we stimulate this myocardium at point B, the cells at point B becomes positive charge because of depolarization, and they make adjacent cells positively charged. So what happens is that there is a positive depolarization vector. So this is the depolarization vector here, and the head of this depolarization vector is positive because depolarization is a movement of positive charge. Now here the positive charges are moving towards a negative electrode. When positive moves towards negative, there is negative deflection. So in this case there will be negative deflection. Clear? Now moving on to the case number 5th. Let's take the same resting myocardium, but let's increase the thickness of this myocardium. If this was 1 millimeter myocardium, let's make this 2 millimeter myocardium. Clear? These are the cells of this myocardium. Clear? This is point A connected to the negative terminal of galvanometer. This is point B connected to the positive terminal of galvanometer. These cells are all resting. That means they are negatively charged inside. So this is the resting myocardium. Now, and this is the galvanometer. This is 0. This is minus 10. This is minus 20. This is plus 10 and this is plus 20. These are the readings of the galvanometer. Now we stimulate at point B. When we stimulate at point B, we see that these cells at point B become positive charge, and there is a movement of positive charge. There is a movement of depolarization from point B towards point A. So the depolarization vector is like this. The head of the depolarization vector is positive because positive charge is moving towards point A. Clear? But here the thickness of the myocardium is double as compared to the thickness in the case 4. So the length of this vector will be twice as compared to the case 4th. So the length will be more. Why the length will be more? Because the thickness of this myocardium is double as compared to the thickness in case 4. So the number of cells undergoing depolarization is more. Similarly, now this positive is moving towards a negative electrode. That means here will be the negative deflection, but the deflection in case 5th will be twice as compared to the deflection in 4th. In case 4th there was negative 10 deflection. Here will be negative 20 deflection. There will be negative deflection as well, but the magnitude of the deflection in case 5th will be twice as compared to the case in case 4th. So the deflection in case 5th, the magnitude of the deflection in case 5th is twice as compared to the magnitude of the deflection in case 4th. Clear? So positive moving towards negative, deflection is negative. Now we will move on to the case number 6th. Now moving on to the case number 6th. Let us suppose this is a myocardium. This is point A, this is point B. B point is connected to the positive end of galvanometer. A point is connected to the negative end of galvanometer. This myocardium is resting, meaning all the cells are in negative state. Clear? When we stimulate this myocardium at point A, what happens is that a wave of depolarization starts at A, and eventually the wave of depolarization moves towards B, and the head of the vector is positive. Clear? Now all the cells become positive charge. Now when all the cells became positive charge, now it is not a state of resting membrane potential, it is a state of complete depolarization. Clear? And after complete depolarization, repolarization starts. Now what is this repolarization? First, let us suppose this was the resting cell of a human heart. Initially the cell was negatively charged inside. When we stimulated the cell, sodium came inside the cell and the inside of the cell became positive. And when inside of the cell became positive, we call it depolarized state. Now the cell is depolarized. After some time, this cell will lose this positive charge and it will go back to its original form when inside the cell was negative. And that stage is called repolarization state. Clear? So first the cell will gain positive charge inside and undergo depolarization. Then it will lose this positive charge and go back to its original negative form when inside the cell was negative, and that stage is called a repolarization state. So after complete depolarization, repolarization starts. Now the question is, where from repolarization starts? For that you will have to remember, first to undergo depolarization is last to undergo repolarization. Clear? This is the statement you have to remember. Now take this myocardium here. This is the myocardium. Clear? And these are the cells of this myocardium. Clear? This point A connected to the negative electrode, this is point B connected to the positive electrode of the galvanometer, and this is the galvanometer at point 0. This is positive deflection and this is negative deflection. Now, first to undergo depolarization. We give stimulus here, that means these are the cells which first undergo depolarization. So these are the cells which undergo depolarization. These cells will undergo repolarization, but they will undergo repolarization at last. That means these are the cells which will undergo repolarization first. Clear? Why will they undergo repolarization first? Because these are the cells which undergo depolarization last. Clear? So repolarization starts from point B, and this repolarization moves from point B towards point A. So what is this vector? This vector can be represented like this, but the head of the vector is negative because it is a repolarization vector, and the repolarization vector is a movement of negative ions, and this movement is from B towards A. So repolarization is a vector, it is a vector of negative. Now negative ions are moving towards the negative electrode. When negative moves towards negative, there is a deflection, and that deflection is positive. So in this case of repolarization, negative is moving towards negative, so the deflection will be positive. Very simple to understand. Let's move towards the case number 7th. Let us suppose this right here is a myocardium, that is a part of heart. Clear? But this myocardium is atrial myocardium, that's a part of atria. Clear? And let's suppose its cells are resting. Resting means the cells are in a negative state. Clear? This is point A and this is point B. When we give stimulus at point A, what happens is that a wave of depolarization starts at A, and this wave of depolarization moves towards B. So this right here is a wave of depolarization in atrial muscle. Now let's take the case number 8 here. Let's suppose this is another myocardium, but this myocardium is Purkinje fibers. These Purkinje fibers are found in ventricles. Clear? And let us suppose its cells are resting. That means the cells are in a negative state. When we stimulate this Purkinje fiber at point A, what happens is that a wave of depolarization starts at A, and this depolarization wave which started at A is moving towards B. And this right here is the depolarization vector of this Purkinje fiber. Now, let us suppose this is a heart cell and this is another heart cell. Between two adjacent heart cells, there is presence of gap junctions. So, one cell communicates with another through gap junctions. When this cell becomes positive, these positive ions move through these gap junctions and make this cell positive. So, in atrias of the heart, the number of gap junctions are less in number. When the number of gap junctions are less in number, so this cell does not communicate with this cell effectively. So these cells communicate less. When these cells communicate less, that means wave of depolarization will be small. Because there are less number of gap junctions, there is less communication. When wave of depolarization will be small, that means deflection in galvanometer will be small. Clear? Similarly, in Purkinje fibers, the number of gap junctions are more in number. When gap junctions are more in number, that means this cell will communicate with this cell very much effectively. When they communicate very much with each other, that means wave of depolarization will be large. So in Purkinje fibers, the wave of depolarization is large, while as in atrias, the depolarization wave is smaller. When the wave of depolarization is large in Purkinje fibers, that means deflection in galvanometer will be large. So this was the case 8th and case 8th and case 7th. In atrias, the depolarization vector is smaller, while as in Purkinje fibers, the depolarization vector is large. It is only because of the number of gap junctions. Number of gap junctions are less in atrias and the number of gap junctions are more in Purkinje fibers. So far we studied what is ECG, what is the meaning of ECG. Then we studied this ECG machine, it works on the principle of galvanometer, and we studied the 8 principles of this galvanometer. You have to study them again and again, remember them, because this will be your basics in medicine and everything that's coming. Clear? So these are my notes of this part. ECG machine works on the principle of galvanometer, and these are the 8 cases. If you want to check these notes out, join my Telegram channel, or visit my Telegram channel. The link of my Telegram channel is in the description of this video. Now after understanding what is ECG and after understanding the 8 principles of galvanometer, now we will move towards the events in cardiac cycle. Now let us study the events in cardiac cycle. Let us study events in cardiac cycle. Why do we study events in cardiac cycle? Because each event in cardiac cycle produces a particular wave in ECG. What is the first event in cardiac cycle? That is atrial depolarization. Now what is this atrial depolarization? Let us suppose this right here is a human heart, and this is fibrous annulus. It separates 2 atrias from 2 ventricles. So this is left ventricle, this is right ventricle, and this is right atrium, and this is left atrium. Above the right atrium is a structure that is called a sinoatrial node. When the sinoatrial node fires its impulses, it stimulates the cells of the atrias in this way. Clear? When sinoatrial node stimulates the atrias, it results in the contraction of the atrias, or that contraction is called a depolarization of atrias. So this depolarization of atrias can be represented with the help of a vector. That vector is called atrial depolarization vector. Since it is a depolarization vector, so head is positive. So atrial depolarization results in the formation of, or atrial depolarization can be represented by atrial depolarization vector, because this depolarization vector depolarizes 2 atrias or contracts the 2 atrias. Clear? Now what is the direction of this depolarization vector? This is left, this is right, this is upwards, and this is downwards. As you can see, this is the direction of this depolarization vector, that is this. So the direction of this depolarization vector is left and downwards. So what is the direction of this depolarization vector? It is leftwards, downwards. And in the previous slide I told you that the cells of the atrias have less number of gap junctions, so this depolarization vector will be small. That means it will be like this. Clear? It will not be a big vector. Clear? It will be a small vector, and the head of the vector will be positive. If it is a small vector, so it will produce a small deviation in ECG, in galvanometer. Clear? So this is the first cardiac event, that is atrial depolarization. Now moving on to the second cardiac event, that is AV nodal depolarization. Now what is this AV nodal depolarization? What happens is that when sinoatrial node fires its impulses, it results in the depolarization of the 2 atrias. Now the impulses from atrias is coming and it hits this fibrous annulus. Now the impulses are hitting this fibrous annulus, but this fibrous annulus is an insulator. That means it is not allowing the impulses to go from atrias to ventricles. Clear? So all these impulses will die out. They will not move to ventricles. The only electrical window between atrias and ventricles is AV node. This AV node is present in fibrous annulus, and it is the only way through which the impulse can go from atrias to ventricles. So when the impulses hit this AV node, it results in AV nodal depolarization. Clear? And this AV node, when it depolarizes, it holds these impulses or depolarizations for 0.1 seconds because of AV nodal delay. And there are very small number of gap junctions between the cells of AV node. So this AV nodal depolarization will be very small. It will be so small that it will not produce any wave in ECG. So we will not show here the AV nodal depolarization vector, because AV nodal depolarization vector is so small, it is not picked by the ECG. Clear? So this is the second cardiac event. First cardiac event is picked by the ECG. The second cardiac event, which is AV nodal depolarization, is not picked by the ECG. Now let's move on to the third cardiac event. Now let us study third cardiac event. The third cardiac event is ventricular septal depolarization. Let us suppose this right here is the heart. This is left ventricle. This is right ventricle. This is left atrium. This is right atrium. Between the left ventricle and right ventricle, there is a ventricular septum. And it is this ventricular septum which is undergoing depolarization in third cardiac event. This part of heart is called the apex of heart. This is the base of heart, and this is the base of heart. Clear? Now let's do one thing. We will take this part of heart and expand it. So we are expanding a part of heart like this. Clear? So this is apex of heart. This is base of heart. This is base of heart. This is septum, which separates left ventricle from right ventricle. Clear? And this is ventricular muscle. Now what is happening? When AV node undergoes depolarization, here is the AV node. When AV node undergoes depolarization, it sends its impulse to right ventricle and left ventricle. So here is the AV node. When this AV node is undergoing depolarization, it is sending its impulses to the septum of the heart. Septum, ventricular septum, which separates left ventricle and right ventricle. In the septum, AV node gives its impulses to bundles, that is left bundle branch and right bundle branch. So this is right bundle branch and this is left bundle branch. These right and left bundle branches, they continue as fibrous tissue. This left bundle branch and right bundle branch, they continue as Purkinje fibers. So they continue as Purkinje fibers. Now see what happens. When impulses reach AV node, they go to the left bundle branch and right bundle branch. In left bundle branch, there are some fibers coming out of left bundle branch. When left bundle branch gets its impulses, it stimulates these fibers. These fibers stimulate the septum. And when these fibers stimulate the septum, it results in the contraction of the septum or depolarization of the septum. And the direction of depolarization is this. So due to these fibers, there is a vector produced, there is a contraction produced. That contraction is contraction of the septum or depolarization of the septum. And the direction of depolarization is this. And it can be represented with the help of vector. That vector is called ventricular septal depolarization vector. So what is this? This is ventricular septal depolarization vector. And why is it head positive? Because it is a depolarization vector. Clear? So left bundle branches stimulate these fibers stimulate septum, and it results in the formation of ventricular septal depolarization vector, and the septum contracts. Now, what is the direction of this vector? This is left, this is right, this is upwards, and this is downwards. The vector is in this direction, so the direction of this vector will be upwards and rightwards. So this ventricular septal depolarization vector is rightwards and upwards. Another thing, this ventricular septal depolarization vector, it is a small vector. That means it will be like this, a small vector, not a big vector like this. It will not be this, it will be a small vector like this. Why is it a small vector? Because the septum that separates left ventricle and right ventricle have less number of cardiac cells as compared to the ventricular muscle. When it has less number of cardiac cells, that means less number of cells are undergoing depolarization. When less number of cells undergo depolarization, that means magnitude of depolarization will be small. So it is a small vector. Now, what did we study so far? We studied first cardiac event, that was atrial depolarization vector in this direction. Then there was AV nodal depolarization. It is not picked up by the ECG, so there is no vector. So we will write no vector. Then we studied third cardiac event, that is ventricular septal depolarization, and the direction of this is this. Clear? Now a question arises. What is that question? Why doesn't this right bundle branch stimulate the septum and result in a depolarization vector in this direction? Why does not that happen? Why does the depolarization vector is in this direction and not in this direction? It is because this left bundle branch and right bundle branch, they act like electric wires. When they act like electric wires, let us suppose this pencil is left or right bundle branch. It is surrounded by a fibrous tissue, this white. This fibrous tissue is an insulator, and I will show you this insulation from my notes. Look at these notes. This yellow tissue is fibrous tissue. It is surrounding the right bundle branch and left bundle branch clearly, but only in the left bundle branch small fibers are coming out of this fibrous tissue, while as in the right bundle branch no fiber is coming out of this fibrous tissue. When no fiber is coming out from the right bundle branch, that means there will be no depolarization vector in this direction. Clear? And only from left bundle branch are the small fibers coming out, so there will be only one vector that will be in this direction called septal depolarization vector. Now let's move on towards the fourth cardiac event. Now let us study fourth cardiac event, that is major ventricular depolarization. Clear? Now what is major ventricular depolarization? To understand it, we'll make a diagram. This right here is left ventricle, this right here is right ventricle, this right here is septum, this right here is base of heart, this right here is base of heart, and this is apex of heart. This is right ventricular muscle, this is left ventricular muscle. This is the diagram that we will need to understand major ventricular depolarization. When AV node sends its impulse towards the septum, it gives these impulse to left bundle branch and right bundle branch. Clear? From right and left bundle branches, these impulses go to Purkinje fibers. So from right and left bundle branches, the impulses are given to Purkinje fibers, which take them to the base of heart. So this is another Purkinje fiber. This is left Purkinje fiber. This is right Purkinje fiber. This left Purkinje fiber sends its impulse towards left ventricular muscle like this, and this right Purkinje fiber sends its impulses towards right ventricular muscle in this way. The impulses which are given by left Purkinje fiber results in a depolarization vector that is in this direction, and it is called left ventricular depolarization vector. Similarly, the impulses which are given by right Purkinje fiber to right ventricular muscle results in the development of a depolarization vector that is called right ventricular depolarization vector. Among left ventricular depolarization vector and right ventricular depolarization vector, this left ventricular depolarization vector is stronger and this is weaker. Why left ventricular depolarization vector is stronger? Because the left ventricular muscle is more thicker than right ventricular muscle. This left ventricular muscle is almost 3 times thicker than right ventricular muscle. That means this left ventricular muscle, it has more number of cells. When there are more number of cells in a left ventricular muscle, that means the depolarization of left ventricular muscle will be stronger, because here there are more cells to undergo depolarization. Now what is the direction? This is left, this is right, this is upwards, and this is downwards. The direction of left ventricular depolarization vector is this. So it is leftwards and downwards. So left and down. Right ventricular depolarization vector is towards this side. So that is downwards and rightwards. So this vector is down and right. Clear? This left ventricular depolarization vector and right ventricular depolarization vector can be added together because they are vectors, and their resultant will be like this. This is called major ventricular depolarization vector, and this major ventricular depolarization vector tells us that these ventricles are depolarizing or contracting. Clear? But what is the direction of this major ventricular depolarization vector? It will be towards left ventricular depolarization vector because it is stronger than right ventricular depolarization vector. Among these two, this one is stronger. So this major ventricular depolarization vector will also be leftwards and downwards like this, because this one is stronger. Now, this was the fourth cardiac event, that is major ventricular depolarization. Now moving on to the fifth cardiac event. Fifth cardiac event is basal ventricular depolarization. What is basal ventricular depolarization? When Purkinje fibers take the impulses to the base of heart, this is the left Purkinje fiber taking the impulses to the left base of heart, and this is the right Purkinje fiber taking the impulses to the right base of heart. It results in the depolarization of the base of heart, and two vectors are produced. One vector is produced here and another vector is produced here. Those vectors are basal ventricular depolarization, and the direction of those are like this. This is one and this is another. Clear? So these are basal ventricular depolarization vectors. Now what is their direction? This is left, this is right, this is up, and this is down. This is the direction of basal ventricular depolarization vectors. So this is upwards and rightwards. Similarly, this is upwards and rightwards. Clear? So what did we study so far? Let's suppose this is the heart, this is left ventricle, this is right ventricle, this is left atrium, this is right atrium. Clear? The first cardiac event was atrial depolarization vector. Then there was AV nodal depolarization vector, but it is not picked by the ECG. Then there was septal depolarization vector in this direction. Then there was major ventricular depolarization vector in this direction, and then there is basal depolarization vector in this direction. So we see that this ventricles, it depolarizes in three phases, that is septal depolarization, major ventricular depolarization, and basal depolarization. Clear? Now let's move on to the last cardiac event. Now let us study the sixth and the last cardiac event, that is ventricular repolarization. To understand ventricular repolarization, we will make the diagram of the ventricles like this. So this is apex of heart, this is septum, this is left ventricle, this is right ventricle, septum separates left and right ventricle, this is base and this is base. Now, to understand ventricular repolarization, we need to understand a statement that is first to depolarize is last to repolarize. Now look, what is the first part to undergo depolarization in ventricles? That is septum. So septum depolarizes first. What is depolarization? It is the movement of positive ions inside the cells. So these cells become positive, that means wave of depolarization starts in septum. Now this wave of depolarization gradually moves towards apex, and apex is the part which undergo depolarization last. So if apex undergo depolarization last, that means it will undergo repolarization first. And if septum undergoes depolarization first, it will undergo repolarization at last. That means wave of repolarization will start from apex and it will go towards septum. So this wave of repolarization can be represented with the help of a vector. This vector is called a repolarization vector, and it is from apex towards the septum. And what is the head of this repolarization vector? It is negative. Why? Because repolarization is a movement of negative ions. These cells become positive. When they will lose their positive, they become negative. And this wave of negative will move toward septum. So that is repolarization. Clear? Now what is the direction of this repolarization vector? This is left, this is right, this is up, and this is down. This is the repolarization vector. Clear? Now what is the direction? It is rightwards and upwards. So this is repolarization vector. Another thing that we need to know here is when ventricles undergo depolarization, they undergo depolarization in three stages. That is septal depolarization, major ventricular depolarization, and basal depolarization. Because three different currents are produced, three different vectors are produced, because three different waves are produced in ECG. But when ventricles undergo repolarization, only one wave is produced in ECG. If only one wave is produced in ECG, so we represent this repolarization with only one vector, and that is this vector. So when ventricles undergo depolarization, three waves are produced in ECG, so we have three vectors. But when ventricles undergo repolarization, only one wave is produced in ECG, so we represent ventricular repolarization with only one vector, and that vector is repolarization vector, whose direction is rightwards and upwards. So we completed the definition of ECG. We completed the principle of galvanometer on which this ECG machine works, those 8 principles. Then we studied 6 cardiac events. Now we will trace these 6 cardiac events on ECG paper, and with that our topic is clear. Now moving on towards ECG tracing. How do we do ECG tracing? For ECG tracing, we take a patient, and this is the body of the patient. These are the arms of the patient. These are the legs of the patient. Clear? And this is the head of the patient, smiling head. And in the chest, we make a heart of a patient. This is the heart, left ventricle, right atrium, left atrium. We make this heart bigger for understanding purposes. And this is right arm, left leg, right leg. Now what we do? We take a galvanometer. Here we take a galvanometer. This is the galvanometer. This is the needle of the galvanometer. We attach one electrode, the positive electrode, to the left leg. So positive electrode is attached at the left leg, and negative electrode of galvanometer is attached at right arm. For convenience, we attach this negative electrode at right wrist, and for convenience, we attach this positive electrode at left leg, left ankle. Clear? Placing of this negative electrode at right wrist or right shoulder is one and the same thing, but for convenience, we place it at right wrist. So this negative electrode can be assumed it is here, and this positive electrode can be assumed it is here. Now, this is the galvanometer. The 2 electrodes are joined. This is the needle of the galvanometer. It will either show positive deflection or it will show negative deflection, and this needle of galvanometer is attached to the ECG paper. This right here is the ECG paper. This ECG paper moves in this direction, and when ECG paper moves in this direction, the needle of the galvanometer is doing deflections. So the deflections of the galvanometer is producing a particular pattern on the ECG paper. That pattern is called ECG recordings. So we will see those recordings in coming minutes. Now, initially, this galvanometer, the needle of the galvanometer, is at rest. That means it is not showing any deviation at all. Then what happens is that heart does its work. What is the first electrical event that occurs in heart? The first event that occurs in heart is atrial depolarization. Atrial depolarization means contraction of the atria. Contraction of the atria or depolarization of the atria can be represented with the help of atrial depolarization vector, and the head of this vector is positive, and this is the direction of this vector. As you can see from this diagram, atrial depolarization vector is a movement of positive charge. This positive is moving towards the positive electrode, so the deflection in the galvanometer will be positive, and that deflection is called, so the deflection is positive and the deflection is called P wave. So what is P wave? P wave represents atrial depolarization or contraction of the atria. Now, after P wave or after atrial depolarization vector, what is the second electrical event that occurs in a heart? Second electrical event is AV nodal depolarization. But this AV nodal depolarization, the current of this AV nodal depolarization is so small, it is not picked up by the galvanometer, so there is no wave in the ECG. That means we get a straight line. So this straight line represents AV nodal depolarization, because AV nodal depolarization is a small current and it is not picked by the needle of galvanometer or needle of ECG. Now moving on. What is the third cardiac event that occurs in heart? The third cardiac event that occurs in heart is septal depolarization, which can be represented by septal depolarization vector like this. So this is septal depolarization vector, and you can see the direction of the septal depolarization vector. Positive is moving towards a negative electrode. That means when positive moves towards negative electrode, the deflection in the galvanometer is negative. So we get a negative deflection like this, and this is called a Q wave. So what does Q wave represent? It represents septal depolarization. After septal depolarization, depolarization means contraction of the ventricular septum. So septal depolarization is called a septal contraction. Now, what is the next cardiac event that occurs in heart after septal depolarization? After septal depolarization, the next cardiac event that occurs in heart is major ventricular depolarization, and this is the vector that represents it, and the head is positive because it is a depolarization vector. So positive is moving towards a positive, so the deflection in the galvanometer will be positive. The deflection will be like this, and this is called R wave. So R wave in the ECG recording represents major ventricular depolarization. Clear? After major ventricular depolarization, the next cardiac event is basal depolarization like this. and this is the direction of this basal depolarization vector, and the head of depolarization vectors is positive. So this is positive and this is positive. Now this positive and this positive is moving towards a negative electrode, so the deflection will be negative, and that can be represented like this. It is called S wave. So S wave represents basal depolarization because positive is moving towards negative. After basal depolarization, there is no movement in the ECG. There is no deflection in the galvanometer, so we get a straight line. After some time, there is another vector. There is another electrical event that occurs in heart. That electric event is called ventricular repolarization, which can be represented with the help of vector called ventricular repolarization vector. This ventricular repolarization vector has its head negative, because all the repolarization vectors have their heads negative, because repolarization is a moment of negative charge, and depolarization vectors have their heads positive because depolarization is a moment of positive charge. So negative is moving towards a negative electrode, negative charges are moving towards a negative electrode, so the deflection will be positive. So after a straight line we get another positive deflection, and this positive deflection is called a T wave, and this T wave represents ventricular repolarization. So this is the pattern, ECG pattern we get on ECG paper. So this ECG pattern depends upon the position of the electrodes on the body. If we replace the position of electrodes on the body, we will inverse the pattern on ECG. So this pattern on ECG is variable. It is variable. It depends upon the position of the electrodes. So what is the ECG that we got? This is first P wave. Then we got a straight line, that is AV nodal depolarization. Then we got a Q wave, that is septal depolarization. Then we got a P wave. Then we got a R wave, that is major ventricular depolarization. Then we got a S wave, that is basal depolarization. Then we got a straight line, and then we got a T wave, that is ventricular repolarization. So P, Q, R, S and T. Now this P wave represents ventricular atrial depolarization. This Q wave represents septal depolarization, R wave major ventricular depolarization, and S wave basal depolarization, and together they represent ventricular depolarization. Then we have T wave, which represents ventricular repolarization. So we have a current, we have a wave for ventricles depolarizing, we have a wave for ventricles repolarizing, and we have a wave for atrias depolarizing, but we have no wave for atrias repolarizing. Why we have no wave for atrias repolarizing? Because when atrias repolarize, at the same time ventricles undergo depolarization. So this atrial repolarization is masked by ventricular depolarization. That is why we have no wave for atrial repolarization. Is that clear? Repolarization means relaxation, depolarization means contraction. Clear? So this is the pattern we get on ECG, and the most important point is this pattern of ECG, it is relative. It depends upon the position of these electrodes. If we replace the position of these electrodes, we will inverse the pattern of ECG. Thank you very much. Your Dr. Droogway here. Keep revising, keep studying. God bless you.